Hi, my name is Lakin Gore. I'm a registered nurse, and today I'm going to be talking about the importance of seeing a licensed OBGYN early on in pregnancy or suspected pregnancy to decrease the rate of maternal mortality rates, specifically with molar pregnancies. So, what are molar pregnancies? It's a complication of what is suspected to be a normal pregnancy, and it only happens about 1 in 1,000 pregnancies. So it's the unusual growth of trophoblasts. Those are the cells that normally would become the placenta. Um, so it happens in two different ways, um, and it's all genetic and just a random thing that happens. It can't be prevented. It's just a random kind of freak accident. So the two different types, a complete molar pregnancy, that happens whenever one sperm cell meets an empty egg. So there's nothing in the egg for the sperm to multiply with. So it just multiplies by itself, um, and it creates this uh, what they call a grape-like cluster in the uterus. These are all cells that have just multiplied, but they don't have the correct genetics and chromosomes inside to create a baby. So there's no fetal tissue in a complete molar pregnancy. Now, in a partial molar pregnancy, that happens whenever two sperm cells meet a normal egg. So the normal egg has all what it's supposed to have, and but then there's two sperm cells, so it will meet each other and multiply, and that can create some fetal tissue, but it's not going to become a viable pregnancy. It's just some tissue that might resemble um, a fetal structure, but it also will have some of the grape-like cysts mixed in with it. So whenever you uh, go to your ultrasound, you're pregnant, you're going for your ultrasound, they come in, they see the grape-like cluster in your uterus, and they'll confirm the diagnosis with HCG blood work levels. And so whenever this happens, whichever type that it is in molar pregnancies, your HCG blood work level will skyrocket. It'll be way up higher than what a normal pregnancy would be. So that kind of confirms the diagnosis. They see this on an ultrasound. That's clearly not a baby. There's no heartbeat. There's no real fetal structures there. So they see that, and then they confirm it with the HCG blood work. Again, it's really high. So in that case, whenever the HCG is high, that kind of triggers your symptoms. Um, if you don't find out at your doctor's appointment, then if you don't go early enough, then you might have some of these symptoms. So with high HCG levels, that can take a normal pregnancy symptom of nausea and vomiting to more of a severe route. So you're going to have some severe nausea and vomiting, and again, every pregnancy is different. Some people respond to pregnancy different than others. So some people already do have severe nausea and vomiting, but that's one of the symptoms here for this particular case. A telltale sign of a molar pregnancy, if you haven't already been diagnosed at your doctor's office, you might pass through your vagina some like grape-like cysts. The ones that you see here, they might come out. and with like some bleeding. Usually there's actually heavy bleeding. So that's the telltale sign of a molar pregnancy. If it hasn't been diagnosed, you might see that and think, wow, something's really wrong. That's not a common thing to happen. So then with the HCG levels, again, if they're really high, then that indicates the amount of growth of these cells that there are. So this particular disease process, they multiply rapidly. They multiply rapidly more quickly than a normal pregnancy would. So it's going to grow and expand the uterus quicker than what you would be at that time frame for a regular pregnancy. So the 10 weeks, what a uterus might look at a 10-week stage in normal pregnancy is completely different than what 10 weeks of a stage of molar pregnancy might look like. This is going to be bigger. It's going to grow faster. So you're going to have more pelvic pressure and more pain. So then moving on to our treatments. Everything's got its process. So starting simple, the treatment for this is a DNC, which is a dilation and curettage. So they go in, they suction out everything in surgery. You're put under some kind of anesthesia. They go in, suck all of this out, scrape it out, try to get everything out of the walls of the uterus. If anything's stuck left in the uterus, then there's risk for it growing again. So if all of the cells aren't gotten out, then it can move on to persistent gestational trophoblastic neoplasia, which is GTN for short. So in that case, they might skip ahead and just do a hysterectomy. And if you're not if you're not planning on having more babies, and just to minimize the complications. So they're going to also monitor the HCG levels. They're really high. They're going to monitor those that they don't continuously multiply. If the cells are multiplying, the HCG level's not going down. So they keep an eye on that for about 6 to 12 months, your HCG levels. And then at its worst stage, if none of that solves the issue, and your HCG levels are continuing to be high, it can progress onto choriocarcinoma, which is metastatic cancer. It can go on to your lungs. So this can end up being a really serious thing if you're not taking care of it quickly. So the prognosis, though, however, if it is treated properly and in a timely manner, then there's a small likelihood of future complications for your body. Once it's treated, it's treated. You can have normal pregnancies after that, but you want to wait those 6 to 12 months while you're watching the HCG levels before you stop birth control and try again for another pregnancy. And then, so after you've got the one molar pregnancy, which the normal rate, the risk for that is about 1 in 1,000. After you've had one, your risk for a second one goes up to 1 in 100. So it's important to go to the doctor and get taken care of in a timely manner so that this can be prevented from moving on any further. So, again, it's important for patients to receive early care to decrease the likelihood of more severe outcomes. And that's all that I've got for you. Thanks. Thanks for listening about molar pregnancies.